So your hip flexor is a group of muscles that run in through the front of your hip. Their job is not only to lift your leg to help you to take a step or put the foot into the car, get your foot up to the next step, but the job of the hip flexor is to make sure that the head of that ball of that in that socket is not pulled too far forward. And so when it's pulled too far forward, either because your hip flexor is too tight, which is typically the case because we spend so much time during the day sitting nowadays, that hip flexor tends to shift the ball closer to the front of the socket. The ball, when it shifts closer, it starts to pinch up against the front of the socket, and you'll get that deep pain kind of right in through the front of the hip. Typically, it'll start out, it's there just when you're walking. It's there mostly when you take a step, because as you take a step and it shifts forward, you get that pinch. But as the problem progresses, it'll start to be there just when you're standing, let's say at the sink, brushing your teeth or washing dishes. It'll be there when you're standing in line. And as it gets even more progressed, it'll be there when you sit, because as you sit, the front of the hip is actually impinging against the front of the socket, creating that pain. Now that doesn't always lead to labral tears, but it can lead to a labral tear, which is another common problem that we see.